Ready to go.
Excellent. Good afternoon and welcome to the Buncombe County Home and Community Care Block Grant Advisory Committee. Today is August 27th, 2025. Shall we just breeze through our welcome and our housekeeping? Are there any revisions to the agenda? I do have one revision. Under 2, we're not going to review the ending fiscal year. We're going to review the beginning of the fiscal year. So I please accept my apologies for that. Other than that, any other revisions for the agenda? No. The agenda stands with the revision. The meeting minutes. Any corrections, additions?
Move approval.
All in favor? Second. Second and all in favor? Aye. Okay. So both are approved. So jumping right in, we're only 1 month in. So I think there's not a lot to discuss about the units of service or the supplemental aging funding providers. Although, could you answer the question for the Buncombe County folks? Are the contracts done? I mean, there are like 6 providers that haven't invoiced, so is that contract still not solidified?
All the contracts have been fully executed except for Mayhead. They've had it held up in their legal department for weeks now, and I did get an invoice, but I'm not able to submit it until the contract's fully executed. So we're still waiting on it. It's been 3 weeks. I'm still waiting on so I can submit that invoice. Day State reached out to me and asked me about submitting the invoice before their contract was fully executed. It was fully executed the day that they reached out. I'm still waiting on their invoice because I did email them. Evelyn Charity said they were going to begin using their Buncombe County funding in August. The Center for Conscious Living and Dying, they're going to be submitting their July invoice soon and their August invoice soon. Mountain Aging Partner said they didn't use any funding in July. Contract is quarterly, and Unite isn't going to start until October, and that's what's in their contract. They're still looking for a space.
Okay.
Yeah.
All right. Well, that's very helpful because I guess I'm sensitive to the fact that last year we had to return money to the county, and it's kind of difficult to ask for more money if we end up returning it. So I appreciate that update. So I mean, Zach, do you have any comments for the units of service or?
No comments really, other than what you already said. It's the beginning of the year, so people should be at 8%. Those that are at 0, it doesn't mean that they haven't spent funding. It probably means that they were just busy and did not get their information into ARMS. So there's really nothing to panic about at the moment.
So if we can put those expenditure reports aside and now we have our chance to discuss the funding priorities and the application scoring tool. And before we get into that, I want to say that we've got a couple of very positive comments from our providers thanking us for the advocacy for the Buncombe County funding. So Billy had a funded provider meeting and shared my email, and I got a couple of very nice comments, one from Elizabeth Williams and the other one from Working Wheels. So I want to let everybody know that our work is appreciated.
Good.
Sorry, the traffic got me. That's okay, I don't know. And then the next thing, and I have this conversation, I have this comment all the time, when we're looking forward to the next funding cycle, folks need to, prepare for the worst and hope for the best. I think, in my opinion, providers need to plan for the fact that federal funding may not be as robust as it has been in the past. And they need to be planning now. Look for other funding sources if there's a way to cut costs. It's just the reality of it, and it's gonna get harder for us as a committee to allocate funds. I'm sure of that. So let's see, I don't know where to start other than I do want to thank Dan. He sent me an email and talked about what is our core mission as the advisory committee? What do we want to articulate as our core mission or core values? And he came with 3: support the safety of older adults, support the ability of older adults to stay in their homes or least restrictive environment, and improve the lives of older adults. So I'm not going to say anything's set in stone, but I like the concept of saying, okay, for this advisory committee, this is our core values or mission with this funding. And starting to the point, yes. And we can refine and work on wordsmithing that and also, refine the scoring tool, which Zach, can you put that up?
Yes.
No. I'll make a point right off. If I remember correctly, Greg at the last meeting mentioned something about how do we know how much funding organizations are getting from other providers. And that's why I sent everybody the budget page that we worked really hard on last year to clarify that, to kind of give us a picture of what their other funding sources are. So really, this go round, I think refining the scoring tool and defining our mission would be helpful to communicate to the providers. So.
Can I just add that the thing I sent you, Susan, was with the notion that once we go through the scoring tool, that looking at those 3 sets of values and that this was much more for our internal discussion. I was imagining that once we have these ranked, then to sit down and say, how do each of these programs support the safety of adults and which ones are vital to protecting the safety of adults. Same thing with the other criteria.
Question about the design of the scoring tool. When it was originally put together, was it intended that the committee would come up with aggregate scores for each applicant? The scores be averaged across all the committee members, and then some formula or algorithm would say, okay, we rank the request for funds according to their scores, and then come up with a way to allocate the money that way. That's not what we do now, and that's not what we've been doing since I've been on the committee, so I've never been. This scoring scheme has never spoken to me, and. You know, the first couple of times I went through the funding, I actually went through and input the numbers to the website. Last year and this year, I didn't. I just downloaded the applications, went to my spreadsheet and took it from there. So maybe this is something.
I think this, to me, this is very similar to what you're saying. To me, what the scoring sheet tells me is how well somebody can write a grant application.
Hmm.
So it reminds me of something that I might do if somebody's applying to speak at a conference or something. I'm gonna score how well they can write and how well they are as their experience as a, presenter and that kind of thing. It doesn't necessarily support how well this application aligns with our mission, our goals. And I think you can make it that way. It just needs to be maybe redone.
Well, that's what we're here to talk about, so I'm anxious to hear other people's.
I think I emailed you, I kind of simplified this and essentially. Okay, name of the organization, the amount they're asking for. Which source of funds. And then ask simple questions, is it a well-defined need, yes or no? Is the project plan well-defined, yes or no? Clients' numbers or service units clear and justified, yes or no? Quality measurements clear and specific, yes or no? And this next one's interesting, coordination with other agencies adequately described, yes or no? And that's one where maybe we want to dig into a little bit more deeply to see if there are redundancies with other agencies in terms of service. And if you add it all together, whether it exceeds the needs of the community or still doesn't even meet them. I'm guessing the latter, but I don't know. And then other than that, do other agencies provide similar service, which connects to that point? And if yes, are there service redundancies with duplication of services and saturation of demand in the community? The equity piece, for a whole host of reasons, I think we don't go crazy with it. Why wave a red flag in front of football?
Yeah, I'm personally, my thought when I looked at the scoring tool is we need to just remove the equity piece.
I think there would be a way to possibly include part of it, but not have it in that same wording. So maybe like underserved population or marginalized community or something like that. If that's what their target population is or something, but I think when you're looking to. It could be construed that you're giving preference to agencies that are run by a minority.
Yeah, and diversity falls into two general camps, employees and clients. Personally, I don't care what cohort somebody falls into if they're willing to work in this space, which is grossly underappreciated, grossly underpaid. I'm just grateful. As to the clients, in my experience with helping someone who has a severe cognitive deficit, access services, what I have found, and it's another state, I don't think it's that different from state to state. The bureaucracy is enormous. You can wait months or years to get through like a Social Security disability claim, a Medicaid waiver program supports claims. And the end result of that, and this was pointed out to me by somebody who runs a supplemental needs trust, that at the end of the day, the clients who have the ability to go through the process, wait out the time, are more likely to have families, usually almost always, with the means to house them, support them, and feed them while they're waiting 2 years, 3 years to get through Social Security, while they're waiting a year or 2 or 3 to get a Medicaid waiver program eligibility grant. It's really crazy. The food stamps seem to be the fastest. You know, the local adult protective services seems to be able to do that pretty quickly. But at the end of the day, oftentimes what happens is that people who need, there's a bias in the community of people who need services toward those who have more help. And that's something that I'm interested in trying to explore how to fix or help fix.
So if we look at, in the current tool, some of those comments relate to, like, can you give us a sense of, you know, your the subjects that you're gonna be, you know, number of clients, and, you know, number of clients with the need. I'm just trying to, I'm trying to articulate what you're saying in terms of putting it in a scoring tool.
And I haven't been able to, unless they're, I think the last time we spoke about SAG being able to, getting training to do some GIS,
yeah.
demographic surveys. That might be the place to start.
Can you tell me more about what that is? I think I might have missed that. Was that last meeting? I might have missed it.
Yeah, so
Okay.
GIS is a mapping system that our economic and community development team uses to kind of identify traffic patterns, pedestrian pathways, things like that, that can also be used against census data to identify where older adults may live. So any missed pockets of older adults, it can also identify aging service providers and senior centers and things like that. So it can give you a better picture of the county itself and what everything or where everything is located, including the clients themselves.
If I can say something, I've always found this real subjective. And one of the things that I find really vague, and it sort of, I think maybe piggybacks on what you're saying, is using the word community. Cause, you know, what community are we talking about?
The
And whose
first one,
community
yeah,
is
the
it?
first one says how, yeah.
I mean, what community, little evidence presented on how the project will enhance the community. Is that, you know, the community of older people, you know, is it the greater Asheville area? Will we be happier because we don't have old people on the street?
And that's very subjective to what you expose yourself to. So some people may watch the news more than others. Others may
Right.
get their news by reading Facebook. I mean, so it really depends on what you think is going on in your community.
So, Zach and I chatted briefly before the meeting, and he encountered one of the council members, and they asked about what the gaps are. And that is a question that I too have heard from, you know, folks who provide the funding. So, the demonstrate the need is how do you answer the question, where are the gaps?
And gaps defined as people who have needs but can't access them.
I have another question. Do I remember somebody saying that we're not supposed to fund income-based programs? Or am I
As in
reading that?
nonprofit versus for-profit or?
No, I mean, like where people get preference for being poor. Or,
The Home and Community Care Block Grant is regardless of income.
Okay.
So there should be no means testing in order to receive the funding. Someone in Biltmore Forest should be able to receive it just as much as someone out in Sam's Branch in Kenmore, just way out in the rural area. So,
okay, I find that strange. Especially when you ask where are the gaps. I mean, I would imagine there would be more gaps in Sam's Gap than Biltmore Forest.
mhm.
Absolutely, yeah. That's a fact.
Yeah, and then a lot of the programs that I used to counsel on aging. They had to be at the poverty line, the income definitely did matter.
Mhm.
And then some not, but most.
And I think that might be where we come in to play, because this is a rule about HCCBG funds. But our committee is the ones that decide where's that gap and where are we gonna put the funds? So you couldn't just have only applicants that did the means-based testing to see that they were gonna use them. But we can choose the ones that are gonna hit those communities that are underserved. And I think that we've demonstrated that before. I don't wanna call out specific places, but I think that we have all demonstrated doing that. Mhm.
Well, I'd again go back to ask us to consider. The question of community is an interesting one. The question of who qualifies is an interesting one. But the core to this, to me, are adults who are at risk, who have a safety risk. Um, Adults who need programs that are there to keep people in their homes and protect folks. In some ways, in this, all of the things that we have, and correct me if I'm wrong, but that what we have in this evaluation tool that we presently use is we don't ask that question. And I think your comment earlier about that it relates to how programs work together and other factors that are important, but particularly with squeezes in fundings coming, that I think those questions will become more important to us.
I think one thing too, Dan, that you, in relation to and I don't have all of them in front of me, the goal, the mission statement or whatever we want to call them. One of the things we definitely are looking at allowing, one of our priorities is allowing the aging population to age safely in place, at their home and without having to go to a facility. And that's kind of like the verbiage these days about age friendly and all of that, age safely in place at home. But the other thing that we do is not only that, but it is related to quality of life, because some of the things are interactive, like providing quality of life of hiking or going to adult day. I mean, that does both. I get it. But there are also those opportunities it's not just the safety and meeting the needs in the home, but also the mental health needs. Maybe that's the answer, or that's the description.
Well, Jen used to say social isolation is equivalent to smoking 15 cigarettes a day, which is 5 short pack. And keeping you in your home is great, but I visited a lot of isolated people that we were feeding and keeping well. And it is nice that day stay and even Meals on Wheels provides some form of socialization. And then again, hiking or anything that in the unit. That's perfect example, and you have told us how they flock to that. That's very successful right off the gate. I think that's a real good indicator. It leads to dementia, heart failure. I mean, it's a big health. I've watched one of my friends who's isolated. She's going into dementia. I mean, an issue that just, it is what it is, but I think that's really important and something that's not presented as one of the major factors that we should consider. And I'd just like to see that whatever program connects with socialization, I think is a high priority for me, in my opinion.
Well, if we can stave off the dementia by
Yes.
socialization, then they
Then we
can
don't
age you in
have
place
that.
at home longer
Exactly.
without, a facility, which is more costly, so it's all a
Or even
domino.
going to memory care, even things that we fund. I mean, yeah. Yeah, the two go hand in hand.
Question about HCCBG guidelines. If their funding allocations are explicitly not to be means tested, as you come down the waterfall to our level, and if we even implicitly take that mandate into consideration, we in violation of any of the rules?
No.
No, because there, I say there's no means testing, which is true. There is no means testing in home and community care block grant services, but there is self-identification. So usually they'll hold up a piece of paper that shows what the federal poverty line is in terms of salary per month or income per month. And if they're below that, they just say, I'm below that, or they say, I'm above that. And that's the only means testing that can be done, and that's on the DOS 101 form. The question has to be asked to all individuals, but that's the extent of it. That's as far as it goes.
And if I can remember the Older Americans Act language, I believe it states, seniors, 60 plus with social, in greatest social and economic need. So even though that's not a, piece of paper that, records the, actual income, it does give a.
There are two variables.
Yeah.
Separately.
Mhm.
If it would help, there is actually a home and community care block grant manual. I won't send y'all the entire thing, but the very first section of it is statement of philosophy and purpose. If you would like to see that, I can share that with y'all. It may help inform not only this, but also our mission statement as well.
What is it again? Philosophy and.
Statement of philosophy and purpose.
And what's it from?
This is the home and community care block grant guidelines or policy and procedure from the state.
From the study.
Yeah.
Okay.
So the one thing that I want to talk about is, when I first started getting involved in this committee, way back when it was called the Allocations Committee, and Ally Climo was running it. She was very adamant about the results-based accountability model. And I have been somewhat disappointed with the applications over the years as they've kind of gotten away from being able to clearly articulate, how much did we do how well do we do it? And is it people better off? And this kind of ties in with, for the county folks. For the county providers having to start doing at least some basic statistic gathering. Zip code. Age, I mean. I don't wanna. I personally don't want that part of the instructions and the way we look at these applications to go away. I think that's a very useful piece of, it's very useful information. I've seen when I got in front of commissioners that was a very effective way to communicate what is the need and who is being provided these services.
So what statistics do we think would be available that might be most helpful?
Well, what are the block grant folks put in arms?
So they put everything that's on a DOS 101. Give me 1 second here, I can pull it up here. Yes, that's all. So we've got just your basic information of address, phone number, social security number, or rather last four of social security number, household status, marital status, race, emergency contact. And then you move into nutrition health scores, which covers, how much are you eating of certain items?
And those nutrition scores are only for like Meals on Wheels and cognitive dining.
Yeah, that's all they are for. Yeah, if you see here at the top, it tells you which sections to complete based off of the services that you render. So,
But just briefly looking at this, you have their zip code. You have their age, right?
Yeah, and the low poverty level as well as sex.
Yeah. So gender.
Could you go up just a little bit? There, yeah, one of I think that whole business there of reasons for making client inactive could be of value to us. Because that gives us outcomes. Some of them not very good, but still outcomes.
I would say though that this is not reported in ARMS. It's literally a drop-down box that states active, inactive, deceased, new registration. I think there's 4 options. But it doesn't ask you to select any of these items. That would be something where you'd have to reach out to every single provider for every single client and get every single registration form.
Well,
I filled that out for the in-home aid program, like when people are inactive, but ARMS doesn't track that, so.
Yeah.
So like, I check one of those boxes or the social worker can tell me other reasons why the person is not receiving in-home aid and is inactive. But ARMS doesn't track that.
I was thinking if there's any way, like zip code, if we're talking about Zach and the GIS mapping, so that would be helpful. I think age would be helpful. I guess I remember, I think it was, On Track. One of their applications was, we serve, for this particular program, there were X amount of people over 80. And it gives a little bit more, and then I think they said it's something like, and half of our clients are over half are female. So I mean, if we could, somehow make the statistic gathering really easy.
There are demographic reports in ARMS that I can pull currently. So for this year already, we have a total of 299 males, 463 females. 347 of those are in between the ages of 60 to 74. 75 to 84 is 286, and then 85 plus is 128. Single, widowed, married, lives alone, functional status well, at risk or high risk. So I've got access to that information in the form of numbers.
But for block grant,
Yeah, but only for block grant.
but only for block grant. So
Correct.
what my focus, I mean, for the applications, yes. I'd like to see more information from all of the folks, but I think in terms of the county funding, something perhaps zip code, age, I don't know, marital status or household status, like, do you live alone?
Yes, that's on there.
You know, do you live alone?
There.
Yeah. I mean, and that could be a yes or no, do you live alone, yes or no, you know?
Do you have a caregiver? That's a good
Yeah.
question.
Yeah,
Yeah.
there's,
Yeah, that's.
if we go further down, there's
Yeah.
caregiver information,
Mhm.
IADLs and ADLs. And
Yeah, I don't wanna get, I mean, for the county folks, I'm thinking this. I'm thinking in terms of advocating to the commissioners, so I'm being kind of selfish here. So if we could do something that would collect very basic information that could able to give them more. More color behind what, what the clients are, that's all I'm trying to say here.
Does that also, I guess I agree with you in terms of getting a compact set of data that is helpful for commissioners to understand is going on in their county. But I guess the other question I had was waiting lists. Because the other thing you want to let them know, it seems to me, is what needs are not being met. And I know, for example, in the in-home aid program, there is a waiting list.
Yes. And if I remember correctly, one year we did have that question in our application. I don't know if it was last year or the year before.
I think it was last year. It was severe. I think it was last year.
Yeah, last year or the year before. And I didn't find the responses helpful. They weren't.
No.
They
Well,
weren't.
I mean, some of them said they didn't keep waiting lists, they just said
Yeah.
no, and that's.
But do we need to be more specific, like how long is your waiting list?
How much time to clear it? How
Do
many
you
people?
have greater than 20 people on a waiting list?
Do you maintain a waiting list? Yeah, I hear you, Dan. I'm not quite sure. We can revisit that in terms of the application itself.
I guess the question would be, in communicating to the commissioners, how do you give them the most robust array of information that helps position them in a place where they would say, if we got any extra money, we'd like to give it to in this area. And that's open, I mean, if it may be that in questions like this that we retool our questions to be very focused and very specific for our applicants to get good answers, useful answers.
I think that, I mean, this is getting super complex, but you could try to make not a cause and effect, you don't wanna talk about that, but you could say that the funding that was spent suggests, and this is gonna take us some time to get it, but like if there was specific, like the number, if we could get like the number of hospital, nursing home placements or something like that, do we want to say that the funds that we're using are affecting that number at all? I don't know, I mean, I think that that's a really powerful thing to me that somebody in that level of leadership would wanna know, but it's gonna be hard to make that, to get that, it's gonna take time, like that's gonna be something that's gonna take a lot of time.
Well, that's where the results-based accountability methodology tries to get at, without getting too in the weeds. Yeah, you ask, how much did we do? How well did we do it? And is anyone better off? And those are the three questions.
And those are the same three questions on the mid-year and end-of-year progress report.
So, and if folks in their mid-year and end-year progress reports could provide us some statistics if they have them, like if they're block grant folks. Say that this program served X amount of people, X amount of older adults in this range, and are they better off? You know, stories. I like stories.
Well,
I
I
think that
think
tells the picture.
most of the end of FY 25, I'm still waiting for a few more, so. It's 96% done, so I have, 2 more providers I'm waiting on theirs. So, but. That should come for next time's meeting and I'll send an email with it.
So back to the scoring tool, do we retool it to ask different questions?
I think so.
I think so.
I think we need more specificity.
More objectivity.
Some things can be answered by a yes or no, but then there's the follow-on to that. It's like, okay. Do any of our providers try to come up with progress statistics for their own internal use?
What do you mean progress?
You know, do any of them track their clients to try to come up with a sense of what they think they are doing well for their clients? You know, for their own internal purposes.
They don't get that.
I would say some of the larger organizations, maybe like
Yeah.
Mountain Care or not Mountain Care, Mountain Aging Projects and because the legal, they do annual reports and things like that, but when you get down to.
Deals on wheels. That's it.
Yeah, Meals
Yeah.
on Wheels, but when you get down to, you know, say. Trying to think of a small effort like Unite, yeah, they may not do the statistics based items.
So I think that might be a challenge here, because a lot of these agencies are running on basically fumes, you know, the money's so tight. That asking them to, you know, build a database they don't have, I think could be a challenge in some. So the question is, how can we, like, maybe what we need to do is come up with some basic, simple questions. Make it as simple for them to answer them. You know, not asking them to write a thesis to justify their existence.
Well, in terms of this, okay, and maybe we need to expand our conversation to include the application itself. But maybe focused, for today,
rest of the day to kind of say, okay, how do we wanna? Do we wanna start off with having, what was that, like a philosophy, a statement of philosophy? Do we wanna start off with something like that? Do we, then start off with, okay. Where are the gaps and how are you meeting them in some regards, rather than the community thing? Here.
Mhm.
And then instead of the terminology generally described, I'm not quite sure. But maybe,
Say that again?
where in the current scoring tool, it talks about, it says 2 to 3. If you're gonna score in 2 to 3, generally describes some evidence presented. And again, that goes to your point, Melissa, of how well did you write?
Yeah, I agree with that.
So maybe we get rid of that kind of language. I would like, I would like to keep some idea of the project plan. But perhaps more, if this is me going back to the results-based accountability. You know. Emphasize the quality measures. I mean, I think we do want to continue to know how many clients they're gonna serve and how many unduplicated clients, so is that clear?
I mean, don't like the waiting list.
Well, I like the waiting list, but I don't like the response that we got from them, from the provider.
I think
about
the waiting list says we've served 1,000 people, whatever, and we have this 3,000 waiting for the same service. That shows the definite need of the community wanting the service. To me, that just says it right there in numbers.
Yeah, it should. I don't understand. Well, I think, as I recall, I mean, a lot of them just didn't keep waiting lists.
Right.
Do we want to require them to keep waiting lists?
I don't think we can.
Well,
No,
well,
no,
yeah.
and I see Zach smiling because this has come up before and the state doesn't have a standardized way to keep. Waiting list information, so they're not gonna mandate it, and
In
think
some
we should ask.
facilities, it's seen as a no-no. Preferential treatment.
Well, the state has come out to say that waiting lists in arms are optional. So they can't, or we can't enforce it if it's optional at the state level. They have made a priority of service tool for the waiting list just to avoid things like that. So where it's, well, Mrs. Smith got on the waiting list before you and you're already descending into, the grips of dementia, but she was on the waiting list before you, so she's gonna get service first and she's, able-bodied and whatnot, but that priority of service tool helps to switch things up and bring the truly significantly frail older adults into, the main spot of that waiting list. But again, that tool is optional as well, so.
Can we ask how many people you turn away?
How many people
That's-
requested?
well, again, that's a database collection.
Well, they can say no, just.
That would be probably.
I did.
Or what about how many people have you served, how many people did you serve last year and how many people requested services?
Requested is a good word.
Yeah.
That
So they
shows
served some and then how many requested?
Mhm.
I don't know. I mean, that way it speaks to the ones who, how they did get the service.
It shows the demand for the service and the need for the service and not and then.
We may or may not have that, but it's.
And they may or may not have it exactly. Well, that's saying, then why don't you have it? But-
So we had about a little less than 10 minutes left in our meeting time.
I'm. I'm. I'm looking for suggestions on how to move forward with the scoring tool. Do we? Do we? Provide the statement of philosophy and purpose, which I like. And then do we at least focus on, you know, what we want to see explained in the applications? Yeah, this is, I mean, like, I want to know the gap. Personally, I want to know where the gaps are. In terms of the project plan, I want to know who they're serving. I want to know, you know, units, people served, unduplicated service. I want the RBA addressed, coordination, yes. I want to, you know, how do you build capacity within the community? And that was another big thing from Ally, is how do you build capacity? And then. I don't know, do we ask about the budget? Or do we just have the budget?
Well, I think for me, the budget, and sometimes, but there have been occasions that it's been enlightening when you look at the salary. Under the budget, that has been kind of enlightening to get a picture. It's not one piece, it's a picture of the whole applicant. The other thing I want to make sure that we don't lose is what other areas are funding, where else are they getting funds?
So I'm not talking about changing the budget at all. My question is, do we have a scoring piece that,
Oh,
a
okay.
scoring piece that says, is
I
this,
see what you're
is
saying.
this? Is that budget that you gave us, does it make sense? I mean, yes or no, I don't know.
Maybe one way to approach this would be to take the established format and put it off to the side individually and go through and think about, based on the general categories, what specific things we would like to know. And then as a group, maybe we take that and come up with a better scoring sheet. Because as we're talking through this, we're kind of following the pattern of what was established whenever it was established. So maybe we use that as kind of a start, as basically it's what we've done, and just say, okay, what would we like to know to give us a better portrait of what this organization does, how they do it, and the numbers that flow, you know, numerical reflections of what comes out of it. I'm not being very articulate today, I'm sorry,
But is that, my question to you, Suzanne, is that more of a application question? And how do we redo the application, or is it more of a scoring tool?
well, I think if we can fine tune what would help us and make things more clear to us, that's feedback into the application itself. Because as I was thinking this through, I said, wait a minute, I'm really more concerned. The things that are popping into my head is the open issues. You go to the application and say, okay, where are we asking about these variables? So I think this feeds back into that. If that makes any sense.
What about, oh, Dan, did you have something?
I was just going to say that listening to this, I found this very stimulating, and I want to continue to work on this. I would imagine, would like to see us spend just a little bit of time looking at our priorities, and then using those going through these questions in this structure, and asking ourselves, how will these questions and this rating help us understand how these organizations are providing safety for children, for adults, allowing them to stay in homes, But I was thinking back to the question about budget and think, well, that's, we've got to review budgets. I mean, this is part of we're part of an accountability process. So I would imagine tweaking some of these and trying to change them so that they reflect values, and then leaving a lot of them as is. But I think that's something that Susan, when you were asking, I would propose that as something that we do next time. Spend
Well,
15 minutes on values and then start tweaking.
Well, what I was thinking is, if people could, if the committee members could try to draft up something and provide me with, like, I don't know, a list of values or whatever the scoring tool, and we can at least, I can compile it so that we would have something that we could look at. I mean, I'd be happy to do that. I don't know what everybody's schedule is, but our next meeting is gonna be September 24th. So could people get things to me by the 19th? And we could, we could, one, set up the statement of philosophy of purpose, give us some ideas on that. And then the different, values for the scoring tool. And then I can compile what folks send, and that'll give us a little bit more structure on how to move forward with actually getting something.
So we're not working on the application,
No,
it's
just-
the statement of philosophy and the values of the scorecard.
Yeah.
Okay.
And then we can go on to the application later.
Well, then I would build the application based upon the
Right.
scorecard.
I have a question for Zach. Is the manuals for various state programs, which I had spent time with over the years, usually have some statement of values and principles and things of that sort. Is that something that's available?
Yeah, I have what you saw me handing out was the statement of philosophy and purpose for home and community care block grant. I'll have Susan forward it to you.
Okay.
But it does go over kind of why it's created and what it is, and it improves the quality of life for older adults by supporting frail older adults in their preference to be cared for at home, et cetera, et cetera. It goes down the line.
Great.
So I see it is 4:29. Are there any closing remarks, comments, announcements?
One quick thing. I'd like to get something of a sense of what it's like for clients and their caregivers to actually access these agencies and their services. That's not something we really get into too much. I don't know how that works into this, maybe something in the application, but what's it like? What's it like for them to become a client of memory care or what have you?
Can we ask where referrals come from?
It's not been.
Yeah, how do clients apply for services? Is it online? Is it by mail? Is it by phone?
From phone call to service,
Yeah.
what takes place? Initial phone call. That'd be a presentation just about that.
Yeah.
Well, as always, I am totally amazed at all the members and their incredible ideas and how seriously you all take this job. And I feel very lucky to be a part of this group. So. Anything further from folks? If not, have a good evening.
So long.